Oh, you have a delivery, impending delivery of 23 weeker and consultant counseled against the resuscitation. And there was a
Hmm.
medical student, Ahmad, who is upset regarding that and discuss regarding the issues associated with the preterm delivery. Okay,
Hmm.
okay. So, shall we start?
Yeah, so the consultant is favoring not to
Not
resuscitate, right?
favoring.
Yeah,
23 weeks.
and medical student is upset. Okay,
Okay.
so
Yeah,
fine.
this is the scenario usually comes, no?
Yeah,
Okay.
okay.
Dr. J, will you keep the time?
Yes.
Okay. 6 minutes plus 3 minutes, huh?
Okay.
Okay. Good morning.
Good morning.
Hello, Ahmad. I'm Dr. Sandeep, one of the registrars here.
Yes, Dr. Sandeep.
Yes. How are you doing, Ahmad, today?
Yes, I'm fine. Thanks for asking, Dr. Sandeep.
And how is your rotation in our department?
Yes, I'm enjoying my rotation
Okay.
and it's going good.
Okay. So I'm nice to know about that. Uh, I heard you have some questions regarding one of the patients in our department. So I thought I'll just come up to you and ask if and answer your queries if you have any.
Yes, I was actually looking for some help and guidance regarding one of the decision taken in. There was a one delivery
Mm-hmm.
happened at the 23 week of gestation, and consultant decide that not to resuscitate. I want to know
Mm-hmm.
in this currently, like we have all ventilators and all the facilities,
Mm-hmm.
why this
Yes,
decision
Ahmad.
has been taken.
Yes, Ahmad, I really appreciate your keenness to learn the things. Actually, this is very important topic. Would you like to invite any of your colleagues to join our discussion?
All of them are now busy in the rounds.
Okay. Okay, not an
So you
issue.
can
Let's
start.
discuss it together. Okay,
Okay.
Ahmad, what do you think? What could be the reason that consultant decided not to resuscitate this child?
Probably he might have thought this baby, if we do resuscitation, may not be
Mm-hmm.
worth to give a good quality of life, because previously
Mm-hmm.
all the babies at this
Mm-hmm.
age usually there is a census like showing
Mm-hmm.
bad results and bad outcome.
Mm-hmm. Mm-hmm. Yes, Ahmad, you are right. And do you think, and what do you feel that consultant should have resuscitated this baby? Why do you think so?
Yeah, I am thinking if they do resuscitation, because previously there were some facilities were not available, like a good
Yes.
quality of ventilators
Yes.
and good quality of surfactant. But now we
Mm-hmm.
have all resources, and many babies, there can be a good hope if we use
Yes.
the optimize the
Mm-hmm.
ventilation
Yes.
and we
Yes.
optimize the care.
Yeah. Yes, Ahmad. You are quite right regarding the availability of the facilities, and like in this type of situations, like there is nothing something right or wrong. Actually, we have to take the decisions according to the gestational age. Like you, do you have any idea about the Epicure study?
I heard about
Mm-hmm.
Epicure study one, but that was quite old now. It was done, I think, around 2006. But now we are in 2020.
Yeah, you are right. You are right. There were two studies, two Epicure 1 and Epicure 2. In the recent Epicure study, it has been shown that the babies who are born at the age of 23 weeks or less, they have very less chance of survival. And whoever survives, almost all babies have neurodevelopment disability. Like they will have some or the other problems, like they will have developmental delay. Also, like the babies who are born at very early age go through various problems. Can you enumerate some of them?
Yes, I heard like some baby they develop cerebral palsy. Some of them they develop hydrocephalus,
Right, right,
and some of them they
right.
develop regular hemorrhage also.
Right, right, Ahmed. So resuscitation of such babies, like taking decision, is sometimes quite difficult situation, and in some such situation, we follow ethical framework. They have certain principles that we take help to take the decisions. So, do you have any idea about this?
No, doctor, I don't know about that principles.
Okay, not an issue. So one of the first thing is like autonomy. So can you
6
guess
minutes.
what could be the autonomy?
6 minutes.
Okay. Can you guess what could be the autonomy?
Autonomy is like the rights to take decision about individual rights to
Right,
uh,
right. Like
decision about the care.
yes, yes. Like in case of small babies, the parents are responsible for taking decisions. However, I would like to tell you that even though parents have the right to take decision, the decision should be informed. Like they should know all the pros and cons of a particular decision. It's our duty to give them right information. Do you agree with this?
Uh, yes, yes, doctor.
Yes, that's why consultant discussed all the pros and cons of this preterm delivery, which we have just discussed, and the parent agreed not to resuscitate. Again, the next principle will be like beneficence and maleficence. So beneficence, like we have to do in the best interest of the baby, and maleficence is like not to do any harm. Like what could be the disadvantage if this baby survives? That's we have just discussed that baby will go through various problems, like they will have cerebral palsy, they will have eye problem, they will have lung problem, they will have neurodevelopmental disability. And don't you think that such type of babies will have significant impact on families?
Yes, yes, that is yeah, one of the factor. But there can be chance like at
Hmm.
this week, if if we optimize our care,
Hmm.
the good chances like they may survive and they might have some, like even though percentage is rare,
Hmm.
but they can have life at least.
Yes, yes, Ahmad. Like
And
if if we use all our facilities, then might be a chance that this baby will survive. However, as you know, that the facility of the intensive care and ventilator are few in number. So it is better. Don't you think it's better to give the ventilator or intensive care bed to a baby who has better chance of survival than the babies who have more chance of either not surviving or having a severe disability in a later life? What do you think, Ahmad?
yeah, that is true. But I heard like this baby also was quite precious after 10 years.
Yes, yes,
So I saw the mother was quite unhappy and she was very sad.
yes, Ahmad, this decision could have been difficult for the parents, but like we should think in the best interest of parents also, and we should think in the best interest of babies who have better chance of survival. That is allocating the beds to a better chance of having survival babies. It's called a justice. So we have to think in about parents also and child also. Don't you agree
9.
with me?
Okay, okay, doctor.
Okay, so can you summarize what we have just discussed, Ahmad?
Yes, so we discussed today about like principles uh, of the framework. We also discussed about autonomy, beneficence, maleficence, and justice,
Yes.
and pros and cons of giving providing resuscitation support and not providing resuscitation.
Okay, okay, Ahmad. Here it will clear enough. And I think you should do a seminar on this. What do you think about this?
Yes, that's a good idea. I can think over to prepare a PowerPoint on next week.
Yes. Yes, okay, Ahmad. You can read more about this and we can discuss further if you have any queries. Okay, and I wish you all the best.
Okay, okay.
Thank
Thank you,
you.
doctor.
A little bit more time actually today.
No, no, which is okay. I think Dr. Sandeep, you did good. Was nice. I did not find any kind of a flaws in this communication. Only when you said about ethical framework, uh, I was expecting like little bit two. There are three headings comes in that, no, like life limited in quantity, quality, and refusal informed consent.
That
So I
is
thought
that is
may.
actually that is actually more on those babies who are already on a ventilator or IVH, or the babies who have you can say congenital myopathies. This baby is already not born, so
Hmm,
the more it will go in the terms of autonomy, beneficence, maleficence.
hmm.
Like withdrawal of care, if you think, then that will be like more of life limited in quality, quantity. Also, we can
Hmm,
mention them quickly when the way candidate ask regarding that the way at least baby will survive. There we can mention quickly. Here, I think regarding resuscitation, this autonomy, this the book also mentions the same.
hmm. Okay, so
Mark
I mean,
Mark scenario, they have mentioned that they have not mentioned this under the heading of resuscitation. They have mentioned life limited quantity quality in that withdrawal of care. That last scenario we did.
hmm. So here they are mentioning only this autonomy
Here they have
beneficence
mentioned
and this.
only these four principles. However, we can think of mentioning quickly under the heading like when the candidate asks at least the baby will be alive and baby
Hmm,
should get a chance to survive. There we can mention quickly when we mention the beneficence and maleficence.
hmm. Yeah,
I think
because basically this is a DNR. See, this is like baby is not born, but the other case is like baby, let's say a child who is very sick, and you are not talking about withdrawal of care, but still you will allow ventilation care, and sometimes we fill the form of DNR. Like if in case he needs resuscitation, nobody will attempt it. So that is DNR, right? Do not resuscitate.
yes,
So do
yes.
not resuscitate. Also, I think should be on the same line with ethical framework.
See, like
I'm not sure
here,
about
like
this, but I'm
here
just
we have actually here we are considering resuscitation in baby who are not born already. We are going to go by the data available, epicure study data.
hmm,
That
hmm,
what we are you are saying that baby has already born. We know the prognosis because we have already assessed the baby. We have already seen the problems through which he is going. I think there we can mention life limited in quality quantity. We know that now the baby has his life is limited or life is quality or life is limited in quantity. Here the babies we are not born. We know that by data. So I think there these the four principles will be more relevant, and this quality
hmm,
and quantity we can mention quickly there.
hmm. Okay.
Those who are already suffered like IVH grade 4, they're more that thing will be better mentioning the limited life quantity and quality. And if you
Yes,
discuss
Dr.
the
Sandeep is right. Dr. Sandeep is right. DNR or actual final resuscitation counseling we will do after birth. Okay, before birth we can only say the data, epicure data,
Hmm, hmm, hmm.
because this type of counseling, repeated times, not only one time, before birth. Two person will counsel, registrar and consultant. After birth, again, two person will counsel. First, at the time of birth, registrar, and after some time, consultant will come. He will again counsel, and then if the consultant see that the baby's condition is not good, he will not viable, then again consultant will go to the parents and take the final consent that we are going to withdraw. We are going to withdraw like this. There are multiple
I have faced this situation in the real life. I will
Hmm.
tell you, like first counseling, as Sandeep he mentioned, and after that, what is the outcome? Delivery is going to happen. Abortus will be there, okay, and again you will talk to the consultant will hold the registrars like, okay, now don't do anything, and he
Hmm.
will call the father or the concerned person and again tell, look, this is the product about us product, because 23 week, as we decided, we will not give any support. So this is a real situation. Then they sign papers and everything.
Hmm.
So I don't know. I mean, I'm not quite sure about this. His communication was absolutely fine. There was no flaw. I'm just raising concern, like, can we uh, go in this way? Or I think what he said was absolutely correct. Nobody can penalize in what he said. All right. So it was good. Then one more thing. Did you mention any data? You did not give any numerical. Was it kind of intentional? You did not want to give
Actually,
number
I
like.
know that 80% babies will have severe neurodevelopmental disability. I don't know how many
Hmm,
will die. More than
hmm, hmm,
80%
hmm.
will have severe disability and 20% will have mild to moderate. But I don't know how many will survive.
Yeah, survival only 23 week is just, I think, 2% only.
Okay.
Survival itself is
But I shared the
limited.
slide to
So
you. That does not mention the survival rate.
there is one another. I think there is one more data is there in the same. I don't know whether you took it from the same, but I will share later on. There is like
Okay.
1 or 2% is the only survival with the 23 week.
Okay. Okay.
So outcome is
If you
definitely
have that data, then just share. It will be better.
mm, yeah, okay.
So
And otherwise, there was nothing wrong, nothing.
actually, I feel like I came to the agenda little late, and I have to little bit hurry to mention for mentioning the all four principles. It could have been like initial discussion could have been little bit less.
Justice, how will explain, Dr. Sandeep? Justice in this, the resources, ventilator and like
Yeah,
that.
like
How?
resources, I told here that you know that beds of the ventilator and intensive care are very limited. So,
Mhm,
to whom you will give the bed? The baby who has better chance of survival, or the baby who has more chance of neurodevelopmental disability.
mhm,
That way, I explained.
Okay.
But if you discuss this with parent withdrawal of care, that time you don't have to mention at all, huh?
Mhm,
Justice. Justice
Assalamu
you will not
alaikum.
discuss with the parents.
mhm.
We can discuss with the colleagues and we can discuss with the medical student.
True.
Yeah, and preferably we should call the candidate, the student or colleague with by name. Huh? Here I purposefully called him Ahmed, not Dr. Ahmed.
Mhm.
So just remember that
Yeah.
not many people are saying like you people saying Dr. Ahmed, Dr. Ahmed. That this is not right.
Mhm.
Mm.
Okay, so Dr. Yaman is here. 25 minutes already done from this. So we will rejoin to complete the history.
Yeah, yeah. Otherwise, it will be
So it will be a complete recording. Okay.
okay.
Rejoin, I'll send a link again. Huh?